Hello, I'm Sarah. I've been in remission from borderline personality disorder for almost 2 years, and I'm back today to share 5 more pieces of advice for anyone who has, or thinks they might have, BPD. I'm only wearing the same outfit as the last video for the sake of continuity. It's definitely not because I have an incredibly limited wardrobe. Please watch part 1 if you haven't yet, because the advice I shared in that video will help with the advice I will share in this video, which will focus more on work you can do to further understand and improve your BPD symptoms. In that video, I recommended that you identify which of the 9 main BPD symptoms you have and determine their severity level and the forms that they take specifically for you. A lot of those symptoms involve negative behavior patterns, which you can learn to change. After you identify those negative behavior patterns, you need to dig in a little bit deeper to get a better understanding of them. To do so, my first piece of advice is to identify and reduce your triggers. A trigger is a person, situation, event, feeling, thought, or memory that leads to those negative default response patterns. To learn to change those patterns, it's important to learn what sets them off in the first place. Lolita's here. In my last video, I recommended Dr. Daniel Fox's Borderline Personality Disorder Workbook, and I will put that link in the description again if you haven't gotten that yet. In this workbook, he lists 8 different types of triggers and provides prompts to help you understand and explore those triggers. I'm not going to get into each of those types now, but I do want to focus on one that I find especially important for people with BPD. Presence of others, which includes the people in your life. I highly suggest that you seriously evaluate the relationships in your life. Keep in mind that when I say relationships, I don't just mean romantic ones. I mean any relationships in your life that are currently affecting and influencing you. So forget about your feelings attached to these relationships and start by thinking honestly about which relationships are overall positive and overall negative for you. Don't immediately write off the relationships that affect you negatively because not all of them necessarily have to. BPD traits and symptoms can make interpersonal relationships difficult even with people who aren't toxic or incompatible. So it's important to understand where your own triggers are within those relationships, and as you start to fix your own side of things and improve distress tolerance, emotion regulation, and communication skills, you might be able to develop some of those negative relationships into more positive ones. But don't be afraid to cut your losses. You need to leave behind relationships that are too unhealthy. You probably already know, at least deep in your heart, exactly which relationships these are for you. Please trust me when I say they will hold you back. Even if you start getting better and you start learning DBT skills and forming new response patterns, these relationships will continue to trigger you, bring out the worst in you, and set you back. It is hard to let go of these attachments, but no matter what pain it brings you right now, it'll make things easier and less painful for you in the long run. Letting go can help you grow, and it will open you up to more positive relationships in the future. My former partners and a couple former friends can rest easy because I don't feel comfortable sharing the details of my personal relationships on this channel. But I do have a ton of topics I want to cover on relationships, both in general and specifically related to BPD. Also, I don't want to ignore the fact that you can't always just cut off negative relationships, especially if it's someone like your boss or a parent that you live with. But developing new response patterns will still help with those triggers, and you can work on making boundaries that will further reduce them. My second crucial piece of advice is to identify and reduce your escapes. Escapes are the distractions we use to avoid pain, emotions, and discomfort, and I think they're usually the biggest roadblock to personal development for anyone, BPD or not. Escapes are everywhere. There are the obvious ones like drugs and alcohol, video games, social media, porn, binge eating, toxic relationships, you name it. But there are also less obvious escapes that are easier to justify because on the surface they're more healthy and productive. These can include focusing on work, going to the gym, diving into a new home improvement project, or even helping other people. Obviously, I'm not saying these things are inherently bad or unimportant. It's about how much we're focusing on these activities and what we're sacrificing or neglecting in order to do so. It's about finding balance. and staying aware and realistic about whether or not we're using these activities as a means of avoidance. It's important to make sure we're still working on ourselves more deeply and not just ignoring our problems by focusing on other things, intentionally or not. Looking inward and facing our reality and feeling discomfort or even shame is important. That's how we know what we need to change. These escapes provide short-term comfort at the expense of long-term growth. Allowing boredom can be very helpful too. Turning to easy distractions to avoid short-term boredom can increase long-term boredom and dissatisfaction. But again, this isn't all or nothing. Escapes can be helpful and sometimes necessary. Like if you're in crisis, please pick one of the healthier coping mechanisms and distract yourself until you're in a more stable place. But if you actually want to fix your problems, you can't just distract yourself until you have enough distance from the effects of your behaviors and decisions that you can ignore them until the cycle repeats. You'll have to stop avoiding and deal with some discomfort as you work through things once you become more stable. Can you hear her purring? So, I highly suggest that you sit down with a pen and paper or your notes app and honestly break down how you're spending your time. Identify the escapes you're using for avoidance. Then, plan on how you can limit those escapes so you can keep growing. Maybe you set aside 30 minutes of Instagram instead of letting yourself mindlessly scroll throughout the day. Again, it doesn't have to be all or nothing, unless, of course, your escapes are significantly detrimental, in which case, please cut them out. Now, this wouldn't be a very sufficient list if I didn't include this next piece of advice. Learn DBT skills. Dialectical behavior therapy, or DBT, has become the gold standard in BPD treatment, and it's also helpful for other conditions, especially related to issues with emotion regulation and impulse control. If you can get into a DBT program, please try it because they have a very high success rate for BPD recovery. DBT is generally most effective as a structured program with individual and group sessions, and it has other unique qualities that make it an especially effective form of therapy for a BPD patient. But I know that these programs aren't always accessible. They can have long wait lists or be expensive or unavailable completely. Not everyone has that option. But it makes me sad to see so many people online who think that they can't get better because they can't get into a DBT program, or that they have to wait until their program begins before they can start improving. Again, it's better to learn in a structured program from certified instructors, but you can still start learning the concepts and skills of DBT on your own right now. Well, after you finish this video. DBT skills are broken down into 4 categories: mindfulness, distress tolerance, interpersonal effectiveness, and emotion regulation. But learning them is just the first step. They need to be mentally reinforced and practiced while you're emotionally stable, so they'll be available for you to use when you need them most. There are many choices when it comes to workbooks and flashcards and free online resources. You can find guidance online, and I'll compile my own list as I review more of these. I currently have the Dialectical Behavior Therapy Skills Workbook. This one's very popular, and I do like how it's laid out and how the information is presented for self-teaching. And I also have this deck of flashcards by Lane Peterson. This is the DBT Deck. It has reminders, tips, and exercises that you can shuffle through whenever you have a few spare minutes. I sometimes leave these on my nightstand, and if I can't fall asleep, I'll shuffle through them. My brain usually prefers that I do that over scrolling through Instagram. Lane Peterson also has a specific DBT skills deck, and the authors of that DBT workbook also have their own flashcards. So I'd like to eventually buy and try a few different versions and review them and let you know what I think. But for now, I'll include links for the workbook and the flashcards that I currently have in this video's description. If you look up DBT books, you'll probably also find this manual by Marsha Linehan, or a book of her handsheets and workouts. I can't talk. Or a book of her handouts and worksheets. Even though she developed DBT, shout out to Marsha Linehan, her manuals are meant for people who are teaching DBT, not for those who are learning it. They aren't recommended for self-teaching, so don't worry about those. I'll talk about DBT much more in future videos, but for now, please look into getting into a program if you can, and if not, start looking into the skills. It's going to take a lot of time and effort to learn the skills either way, but the sooner you prioritize the work, the sooner you'll start to improve. My next piece of advice is not to rely on therapy or medication. Now, hear me out. I am once again not recommending against professional help. Please get professional help if you are able to. But I'm also once again recognizing that not everyone is able to. Don't think that you can't get better just because you can't get professional treatment if that is the case for you. But if you can get professional treatment, don't assume that that's entirely sufficient for your recovery. There's no known medication specifically for BPD, but in some cases, medications can help comorbidities or other contributing factors to the severity of your symptoms. I'm not going to get into medicine right now, but don't expect a medication alone to make your BPD disappear, and don't expect to suddenly be cured just because you go to therapy once or even twice a week. Like I said with DBT skills, they have to be consistently practiced so they can stick. Even if you're in a full DBT program, they still give you homework to do every week, and you're expected to practice the skills on your own time. It's like exercising. You can't go to the gym one day a week and start drinking protein shakes every day and expect to see significant results without putting in more work on your own time and making other changes to your lifestyle. Now, I know I've been talking a lot about work, but I don't want that word to discourage you. I'm not going to pretend that changing behavior patterns is simple and easy. It is a lot of hard work. But my last piece of advice is to trust that the work is worth it. If you have BPD or symptoms and you've watched this far in the video, I have no doubt that you want to get better. But to truly improve, you need more than intention and knowledge. Like with many things, the results you get out will depend on the effort you put in. And please don't get discouraged if you aren't seeing those results quickly enough. True change takes time. Trust the process. Step out of your comfort zone, avoid escapes and distractions, and take control of the direction your life is going in. Your future self will thank you for it. And my present self wants to thank you for watching this video. I hope you found it helpful. Please be sure to check out those resources I mentioned, or leave your own recommendations in the comments. The links I use in my description are now affiliate links, which doesn't change the price at all for you, but if you place an order through my link, I'll get a small percentage of the sale. In case it needs to be said, I'm not just trying to get you to buy whatever. I'm only linking things I've already personally bought and consumed and would recommend. I'm not even linking this one because I don't recommend it for these purposes. So if you're going to buy any of those books anyway, I'd really appreciate the support by ordering them through my links. I appreciate all your support in general. It's so exciting seeing this channel grow more and more with every video, and I'm glad you guys seem to like them because I'm going to keep making them. I have a lot of work to do for next week's video, but I think it's going to be a really good one for anyone with or without BPD. So please subscribe if you haven't yet, and I hope to see you in the next one. Peace. So please subscribe if you haven't yet. We hope to see you in the next one.